Hello, I'm Annie, practicing nursing student, okay? I'm just going to share what I have because I do check out YouTube all the time. I have my favorites out there who help me extremely with everything that I'm working on. I watch YouTube videos. This is how I study for nursing, okay? I watch YouTube videos, as many as I can. I practice a lot of NCLEX questions. I have the NCLEX RN examination from Mosby. This really helps me. I also have a Med-Surg NCLEX practice exam. Med-Surg Success, that definitely helps me as well. But I also utilize Google. There is a lot of different websites that actually have different ways to study for your NCLEX, okay? So I found it extremely helpful for all of these different things, so I just decided, you know what, this is going to help me learn, this is going to help me study. I have finals next Monday for my Med-Surg exam, so I'm going to maybe aid someone else in this process, okay? Okay, so here we go. Today we're going to go over angina. Alright, so angina, the term for angina, the definition for angina is chest pain caused by temporary imbalance between the coronary artery's ability to supply oxygen to the cardiac muscle's demand for oxygen. So let's just think. Okay, you have something stopping the oxygen to your cardiac muscle. Okay, so think about your cardiac muscle. Your cardiac muscle beats on its own. It contracts. That's your blood pressure. That's your heart rate. Basically circulates everywhere throughout your body. So let's just think of this. If you have any type of cardiac muscle, any type of muscle for that matter, that does not have adequate oxygen, you're going to have ischemia. Okay, and ischemia basically means a scarring due to lack of oxygen. All right. So there's two types of angina. Okay, there's two types that are causing, and then there are two types. So let's talk about the two causing types. Okay, the first one is ischemia, which I just said is lack of O2. Limited in duration and does not cause permanent damage to the heart muscle. So basically, it doesn't create permanent damage. You can come back from it, I guess. That means the cardiac muscle is amazing in some cases. My God. Okay. Infarction basically is termed necrosis or cell death. That's what necrosis means, death. Occurs when ischemia is prolonged and decreased perfusion causes irreversible damage to the tissue. Okay, so let's just think of it this way. Somebody's calling me, I don't know who it is, we're not going to answer. We're going to hit ignore. This is proper studying practices for your NCLEX or your nursing school exam. Okay, so let's think about this. You have ischemia, okay, which is scarring and due to loss of oxygen to that muscle. So if we supply oxygen right away to our patients, if we can reverse this, they should be okay. They can recover from that. But prolonged, meaning let's say we have a patient that is mowing the lawn, okay, has really bad chest pain, doesn't know what it is, kind of doesn't even think about it. It might hurt for a little bit. They could just keep mowing the lawn, and then later on it just doesn't get better, then they go to the hospital. That may be irreversible because it's prolonged and it happened for a significant amount of time, or let's say they didn't go to the doctor until the next day. Okay, that would be prolonged. All right, so now the two types of angina. This is very easy. I like this part. We have stable and we have unstable. Okay, so let's think of stable. Stable means that the man, let's go back to the man mowing the lawn. Okay, the pain started when he began exercising on exertion. That's stable. But if he takes a break and sits down and takes periods of rest, the pain actually subsides. Okay, so the definition of stable angina is basically upon exertion or movement that is relieved with periods of rest. Okay, that's stable. The patient may also have nitro, okay? So if they're aware of this condition, they would have nitroglycerin. So basically, let's say he's mowing the lawn, he develops this pain in his chest, he's familiar with it, he's been educated, very good by his nurse. Congratulations, nurses, you're doing the right thing. So he knows what to do. You've educated your patient. So basically, he would stop mowing the lawn, he would take his nitroglycerin, and he would rest, okay? And it goes away. That's stable angina. Let's think of unstable. Unstable means whether he's resting or not. So let's say he's not mowing the lawn. Maybe it's raining, a rainy day like today. I'm in Pennsylvania and it rains all the time. It's spring right now, so April showers bring May flowers, but it's the beginning of May, so it's actually raining. So let's say he didn't mow the lawn today. He decided to kick back and watch TV. He's watching Game of Thrones. I love Game of Thrones. That's my show. He's kicking back, okay? But he has this uncontrollable pain, and he's just sitting there watching TV. It won't go away, okay? So whether he's mowing the lawn, whether he's chilling, and he's not doing anything, he has this uncontrollable chest pain. That's unstable. Think about it. It's unstable. It's unpredictable. It could happen at any time. I have here, the pressure may last more than 15 minutes with unstable. So it could be for 20 minutes. It could be beyond that. So another important thing here, patient education, information along with your pain assessment. When your patient comes in, you want to ask them, when did the pain start? What were you doing? Does anything alleviate the pain? Is there any aggravating exacerbations with the pain? You know, you just want to know all of these facts, okay? Treatments, nitroglycerin, PRN. So basically you would teach your patient whenever you feel it coming on, you would want to take this. Plavix or aspirin. Let's think of it. Plavix and aspirin are vasodilators, okay? So if you have a loss of oxygen to your blood muscle, things are not contracting properly to get the blood to there, okay? So when we give them vasodilators, either the Plavix or the aspirin, it opens it up. They're vasodilators. So is the nitroglycerin. So basically you're opening up the blood vessel. You're allowing it to flow more frequent, more elusive. Everything is just flowing naturally, okay? Beta blockers. Beta blockers do the same thing. Basically they just enhance the movement of the bloods. Statins. Most of your patients, the risk factors, which I'm going to cover here in a second, I didn't even put on here. My goodness. It's easy though. It's for all of the heart conditions, okay? Hyperlipidemia is one. So that's why you want to give the statins, because atherosclerosis, they're going to have plaque buildup. Hypertension is one, of course. Obesity, sedentary lifestyle, alcohol abuse, smoking, all of the things that are not good for your heart, okay, basically. Then you want to give morphine for pain. So of course they're going to be on a lot of pain. The morphine not only helps with pain, but it also lowers the demand of oxygen to your cells. So that's pretty cool. Morphine works wonders. Make sure you dilute, okay? Unless you work in the ER, they do some kinky stuff in the ER. That's where I want to work. Anyway, let's see here. I basically said everything. So manifestations. So basically you're going to see your patient, they're going to have chest pain, they're going to be short of breath. So your main objective here as a nurse is to give them oxygen from the gate. If you think it has to do with anything with the heart, give them oxygen, okay? You can't go wrong with oxygen. They're going to be diaphoresis, so they're going to be sweating. They may be vomiting, basically just because the pain is so overwhelming, everything is shutting down, or should I say everything's shutting down. They're going to have a high heart rate, they're going to have a high blood pressure, and they're going to have high respirators. Okay, so basically you want to make them as comfortable as possible. Diagnostics. I do not have diagnostics on here, so we're going to take a look. Angina. Alright, so I don't have diagnostics. I guess the diagnostics would be the underlying issue. So if you have a patient that's never had chest pain before, they present to the hospital, they're going to probably do an echocardiogram, EKG, to see, what exactly is going on. Now, if they think it's something that has to do with The brain, like more of like, you know, a TIA would be loss of oxygen to the brain. So, you know, basically angina is an imbalance between the coronary artery's ability to supply oxygen. But the question lies, why? Why is this happening to our patient? So you leave that up to the doctors. Basically, you need to be on point for everything that you need. Supply your patient with all the necessary education that they need. And that's pretty much that. Okay, so thank you. This is my first video. I'm very excited. And I wish you all the luck in nursing school. All right, have a good day.